This is Jody Tropiano, the Content Director for Health, and I'm here with Roy Schoenberg, the President and CEO of Amwell, and we're going to chat a little bit about the COVID pandemic and what Amwell has been up to in battling this crisis. So Roy, thanks for joining us.
Thanks for having me, Jody.
Of course. So I'm excited to kind of get into what you guys have been working on. So first off, would just love to get your initial experiences dealing with kind of the front lines of virtual care of the pandemic. Any highs and lows that you've been seeing?
Yeah, I think, you can plug in a lot of superlatives. It's definitely been the most formative period of time that telehealth has ever known, I think, with the reality that most people that were affected by shelter in place have transitioned all of their healthcare needs to telehealth because they had no place to go and they didn't want to go. Clearly, the urgent care centers, the emergency rooms, even physician offices were closed. So all of that transitioned to telehealth. And then I think the reality was that also a lot of clinicians who wanted to continue to practice their art with their patients realized that if they're going to take care of those patients regularly, they have to use telehealth as well. So it's been a very, very busy period for us, but one that hopefully, further elevates the value of telehealth to everybody.
That's great. And so how have you guys at Amwell handled the surge in new patients right now? Have you hired more physicians in response?
So absolutely. I mean, we've, just to give you a kind of a level setting number, we have seen about 30 times the volume of telehealth that we have more than we've ever seen before. There was a point in time where just to kind of give you a visceral sense to this, there was a point in time where in one day, we have done more telehealth than we've done in our first 10 years as a company, combined.
Wow.
So it's a very, very different kind of playing field. Now, obviously, in order to accommodate that kind of traffic, we had to significantly augment a lot of different parts of the operation. I'll spare you the technology talk about servers and bandwidth and all of that kind of fun stuff. Obviously, that had to be amped in a big way. But to your point, the number of clinicians that were needed in order to handle that, that giant tsunami, needed to be increased as well. And we have deployed a lot of capabilities, technological capabilities that allow us to onboard clinicians automatically and very, very quickly. And our own networks have grown more than 5 times over the course of about 2 weeks. But it all kind of worked well. There were a couple of days there were things were going up and down a little bit with that giant volume, and then things kind of stabilized. And we keep breaking the record every day now, while the system are actually humming well. So that's a good thing.
Well, congratulations on that. It sounds like you guys have it down to a science now. But maybe for some smaller organizations who are having some trouble scaling up their virtual care, what advice would you give them?
Well, I think the question is really, what is the audience that you're trying to serve? And one of the biggest mistakes about telehealth in general is that people think that telehealth is video conferencing. And if you can do video conferencing, you're good. Now, interestingly enough, I would say that, at the darker time during the COVID pandemic, it was almost true, because the reality was, it was an emergency situation. If there's a patient that needs to get in front of a clinician, use whatever you can in order to get care to them. But I think the reality is that, very quickly now, things are getting back into the understanding that it isn't video conferencing. It has to be healthcare. So you need to have the right clinicians in front of patients. It's not any Joe Schmo that says that they're a clinician. You need to verify their background and their license and credentialing. You have to give care to people in a way that doesn't go out of their pocket and takes into account the fact that they have a health insurance, right? Because, that people are not exactly flowing with money these days. You have to be aware of that. You need to have systems that allow medications to go into the right pharmacies so that people can pick those medications. There's a lot of different elements in healthcare that, under the rule of emergency, you can kind of cut corners and say, maybe I don't need that. And that was true for maybe a couple of weeks, and now things are coming back into the fold, where people understand telehealth actually has to be a digital conduit to get to the traditional quality healthcare that was available before COVID, rather than to a shady side of healthcare that nobody knew about.
Yeah.
And I think that's the challenge for younger companies who are trying to cut corners.
Yeah. And how about some of the policy changes and relaxations around telehealth? Even on a state level, I saw Massachusetts is now giving free telehealth assessments for people without insurance. So which ones of these changes, both at a state and federal level, do you think are helping and maybe will stick even after the crisis?
Yes, I would say that there's been some huge changes by way of policy over the last couple of weeks. Probably the most notable one that people talk about a lot was the fact that until the pandemic, physicians could only see patients in their state. You only carry a license in your state, and that limits the ability even of telehealth systems to create encounter between patients and clinicians. It's only kind of the pool of that state. Many states have relaxed those rules over the last couple of weeks. Probably the best example is New York. Needed a lot of healthcare to come in, and the governor said for a period of time we're allowing any licensed clinician in another state to be made available to New Yorkers. And that allowed us almost overnight to dramatically amplify the amount of healthcare that we can make available to residents in the state. And we literally saw the chart kind of flying off the roof. Other states have done similar kind of relaxation. Not everyone did the same thing, but I think the general understanding that is going to stick after the COVID epidemic is that if we are going to be in situations where we need to pool resources together, where we need to load balance the country, where there's a lot of healthcare need in one place that's overwhelmed for whatever reason, and we have a lot of healthcare on the other side of the country that can be projected through technology, we need to find a way to allow those rules to be relaxed. So I think that's actually gonna, is gonna stick in some ways. The other, big change is Medicare. That, paradoxically, and I said this over and over again, the biggest injustice from a telehealth standpoint is that the people that could really benefit from healthcare coming to them are the people that tend to be the elderly, people with chronic conditions, people that have real hard time getting out of bed. And before the pandemic, before COVID, for the most part, that population, people over the age of 65, could not benefit from telehealth because Medicare wouldn't cover it. That has changed almost 180 degrees. At some point, there was a new rule coming out of Medicare that said pretty much anything you can do for a vulnerable population through telehealth, go ahead, we'll cover it. Very different kind of tune. I'm expecting that to be somewhat, restricted when we come out of COVID. I think there's going to be a little bit more, financial instrumentation around it. But the reality is that such a huge part of the population of, that vulnerable population experience the fact that healthcare can come to them.
Yep.
And once you experience that, you can't go back. It makes absolutely no sense to force a cancer patient who's very vulnerable at their home to have to take the bus to go to get their medication changed in a world where they did that perfectly well, during the COVID pandemic without having to take the bus. So I think that's going to change a little bit, but not much. And then the other piece was a regulation called HIPAA, which is the whole privacy, patient confidentiality. That was kind of thrown out the window, for the duration of the emergency, and that allowed a lot of people to do Zoom and Skype and anything goes, in terms of telehealth. And I think that's going to have to come back, after the emergency, because we do care about patient confidentiality. We do care about how our information is being utilized or used. But any way you look at it, it's a sea change. The world will never be the same coming out of this from a telehealth standpoint.
Yeah, that's true. Those are really great points. And how about the importance of what you call website manner during this time?
Yeah, I think one of the things that we've seen over the years, and was even more true during COVID, is that as a clinician, when you're interacting with a patient over technology, there are advantages and disadvantages. You know, the obvious disadvantage is that you can't kind of put your stethoscope through the screen and listen to their lungs. That's, you know, that's a disadvantage. And there are advantages by way of the level of intimacy and the uninterrupted time that you actually have with the patient, which often enough is not the case when you're running between exam rooms in the practice. There are also certain kind of tricks of the trade when you're trying to understand if a patient feels pain somewhere. You know, you can't squeeze that place, but you can ask the patient to move in a certain way that elicits that, and you can watch them. So a lot of the lessons learned over the years, you know, with people who have done tens or hundreds of thousands of telehealth visit clinicians and have shared with other clinicians, what are the ways in which you can get that insight when you're interacting with a patient over technology, have become all important during the COVID reality. I'll just say one other thing is we tend to think about telehealth during COVID as a way to treat COVID patients. And that couldn't be further from the truth, because everything else that requires healthcare had to go through telehealth as well. If I'm a diabetic, or if I have a cancer, or if I'm recovering from surgery, my follow-up now happens through telehealth, and it's got nothing to do with COVID. So a lot of the understandings on how to treat healthcare through technology became much more instrumental during COVID, because we literally had to care for everybody, not just for people that had the flu.
Mm-hmm. And so you touched on this a little bit, but just what are other implications of the influx of telehealth visits during this time, and maybe paint a picture of what you think telehealth looks like after the crisis?
Yeah, so, you know, I think there's no question that the urgent care volume, essentially the people running to telehealth because they are concerned or whatever it is, that's going to come up and that's going to come down, right? I mean, the moment shelter in place is going to get relaxed, you know, there's going to be urgent care centers, there's going to be retail clinics, there's going to be PCP offices are going to open. We're going to see that high volume of urgent care services beginning to come back to normal. They're not going to come to where they were, because so many people now enjoy and feel more comfortable with telehealth, but it's going to come back to some level of normalcy. What's not going to change is the understanding that the interaction with patients over technology in places where there is a challenge of doing it otherwise, people who live very far, people that need very frequent follow-up, and you just can't ask them to show up at the hospital every day because they won't do it. People who can't get out of bed, people that need an ambulance to get to the hospital, people that are immune compromised. In all of these populations, which actually represent a much bigger part of healthcare than people that have an urgent care issue, a rash or a flu or a migraine, in all of those cases, the understanding that we can rebalance the way we care for patients to be a combination of both physical and digital is probably going to be the most impactful going forward. I don't think that there is any health system out there in America today that hasn't shifted part of how it cares for its own patients to telehealth. And that new understanding that now it's a balance is going to make telehealth a big part of how we care for patients. And I would make a naive prophecy, and I would say that it will go further to the point that we'll actually revisit the medical textbooks on what is the appropriate way to follow up on patients that are relatively acute, in a world where we can actually hit a button and check up on them for a couple of minutes in their home without requiring the orchestration of an inpatient visit. We may follow up with them for a couple of minutes every day, and that's going to be how we follow up. Different.
Yep, I hope that's the case. I would bet on that prophecy.
I think it's going to work. I think it's going to happen.
Yeah. And so let's shift gears a little bit and talk about mental and behavioral health. Yeah. So, obviously there's obvious challenges during a pandemic like this. How is Amwell responding to them?
So we have a very large division area in our company that is exclusively about behavioral health. We provide services that include anything from, social workers, psychologists to psychiatrists. We've actually done a large acquisition at the end of last year of the leading telehealth company in the country, a company called Aligned. We've seen definite hike there as well. I mean, I don't need to tell anybody about the awkward and sometimes very challenging reality of living at home with your significant partners and families and whatever it is and everything that goes with that. And we have definitely seen an uptick in that area. We've also seen cases where people who are getting regular care are getting very anxious with the notion that they are going to be disintermediated from the care that they need for other things, for heart failure. And that adds yet another dimension of vulnerability to a lot of people because they need a lot of healthcare and they can't get it. So that in itself adds stress, and it requires a better balancing between behavioral health services and medical services that they get through telehealth. So in every angle, you see both an increase in the volume of behavioral health, but also increase in the diversity of the behavioral health services that people need in the reality that we're experiencing.
Yeah. And I think mental behavioral health would fit into this next question as an example of where digital health has really stepped up during the pandemic. But overall, how do you think digital health's role within the health ecosystem has changed fundamentally because of this crisis?
I think it's probably the best way for me to describe it, what we experienced is that almost overnight, our role as a telehealth operator has changed from modernizing the healthcare experience, which is a noble cause. And, it's more convenient, it's very speedy, it's very intimate, it's in your home and all that kind of stuff. But we transition overnight from that to saving lives. And the saving lives was not about making healthcare accessible to people that had no other way to get to healthcare. It also saving lives by the way of allowing the clinicians' side of healthcare to appropriately decide when they have to interact with patient in person because it's warranted, and when is the interaction with patient creating essentially a level of exposure that's not warranted. And hopefully preventing a lot of our clinicians and frontliners from unnecessary exposure. So I think that transition has permeated not only the telehealth that we do. I can tell you that for everybody that works in Amwell today, people that are part of the organization, the level of purpose has changed. You can see it. We've all been thrown into the back of our kitchen table and, attics and basements and all that kind of stuff. And we all live in that kind of reality. I'm home now as well. Yeah. And yet you would expect that to diminish productivity and get people disconnected and whatever it is. And it was the exact opposite. The understanding that we've been thrown to the front line and that we are now a mission critical, instrumental aspect of doing healthcare at a time that the country is all about healthcare is palpable. Mm-hmm. And I can only say that I take my hat off to everybody in the organization that really put themselves in front of everything. And by the way, it affects their families, it affects everybody around them. But I think that's the best testament to how telehealth has changed, because people feel it. It's a life-saving operation at this point.
Yeah, that's very well put. And so coming to the end here, just wanted to offer you any last thoughts. Could be anything related to what you're dealing with right now or the pandemic at large.
Yeah, I would say that the one thing that I hope that we will all come out of with this is the understanding that technology shouldn't be a threat to the traditional practice of medicine. And I think less and less, but still a lot of people are thinking of technology as a disintermediation, as something that is very impersonal. And I would say that if there's anything that comes out of this pandemic, is the understanding that it is a new balance. Like every other industry, whether it's, you know, entertainment or banking or shopping or anything else, like any other industries that has transitioned from a very physical way of doing business to a balance of physical and digital, over the last 6 weeks, we have advanced the understanding of the healthcare system and the regulators around it and the medical boards and the payer and everybody else to the fact that healthcare, like any and every other industry, will have to go through that transformation to properly take care of the people we care about, which are our patients, our clients, our consumers. And I think that revelation is now a reality. This is not going back. You can't put it back in the toothpaste.
Agree with you there.
Yep.
Well, thank you so much, Roy. It's been great speaking with you. Appreciate all you're doing, and congrats to you and your team for really stepping up during this time.
Thank you. I appreciate it, and we all should stay safe and come from the other side and
yes,
smell the roses.
Look forward
There's
to
a future after COVID.
Thank you, Roy.
Thank you so much.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.